Okay, here we go. Whole body, whole healing, integrative modalities. It's Jennifer Gramith as well as Michelle LaMasa Dawson, and hope you enjoy them as much as I do. Thank you, ladies. Come on down. Wow, what a, yeah, I see that. I see that. Thank you.
Thank you. Let's see. Can everybody hear me good? Awesome. Well, good morning. We've been anxiously waiting over there for the raffles to get up here. And I want to tell you, my birthday is March 30th, so. Yes, but I'm not going to tell you how old I am. All right. Yeah, she will. No, she won't. Well, we are so excited and so honored to be here. Hasn't this been just an amazing conference? Yes. I just love the like-mindedness of everyone. And everyone's so giving, so loving. And I thank you for all of you who have stopped by our booth and shared your story with me. I will never forget it. So Dr. Michelle, and I'm Dr. Jen, by the way, you can just call me that. Gramith, nobody pronounces right most of the time. So my patients could just call me Dr. Jen. My background, I have a traditional background in oncology, cardiology, internal medicine as a nurse. But like so many of you, we all have a story how we got into functional medicine. And my story began with my father and his diagnosis many, many years ago. He was given a death date when he was diagnosed, and that wasn't settling well with me. Of course, we did chemotherapy and radiation because that's all I knew to do. I was a nurse, right? And that's what we did. But it destroyed his heart. But let me tell you this, don't ever give up. Don't ever give up, because had we given up, my father would not have lived, and he did. And so by the grace of God, I'm here today, and it changed my path. Dr. Michelle has an amazing story as well. But today I really want to talk to you about some of the challenges that I have seen. I've been doing this for 30 years. I know. I don't look that old. But I have. Well, so my objective today is really to share with you one of the many, many tools. You know, us practitioners in functional medicine, we have an amazing amount of tools that we throw out. How many of you that are patients feel like you're overwhelmed when you went to your functional practitioner, your naturopathic doctor, and they threw everything but the kitchen sink at you? And you're like, okay, what do I do now, right? We have a ton of tools for you, unlike in mainstream medicine. Now, in oncology, they have chemo, they have now immunotherapy drugs, they have surgery, radiation, cardiology, they have statin drugs and some, good pharmaceuticals, but they have very little, set of tools to use to help you. And so functional doctors can be a little overwhelming because we have so many tools and we want to use them all because they're fun and they're exciting, but it may be overwhelming where our patients kind of run the other way. So I'm going to share with you one tool that I have found to be the foundation of my practice that I think made all the difference with my success rate with clients. And Dr. Dawson is going to share a tool with you as well that I have implemented in my practice that I find to be even more important. And so we're going to present some case studies to you guys. And then we'll talk about how you can, if you're a practitioner, you can integrate these modalities to be even more successful and not overwhelm your clients. And if you're a client, you'll know where to start. Okay, does that sound good? All right, so some of the biggest challenges we as practitioners have, and probably you as patients have, is compliance. We have these great modalities, these great tools, great supplements, but if you don't take them, if you don't do what we say, they don't work really well, right? But I think the compliance piece really comes from our beliefs in ourselves that we are worthy of healing. I know finances is part of it too, but I have found working with patients, when I started as a naturopathic doctor and working with cancer patients, when back 2 years after I started as a naturopath working with patients, I started seeing that they had a lot of trauma. They came in very hopeless, which is very common, for patients who have that type of diagnosis. And my specialty is oncology. I see all kinds of immune disorders as well, but oncology is definitely my passion, my love. But many of them had self-sabotaging beliefs that really hindered them in this journey. And, I didn't really know how to address it. I will be honest with you that, oh yes, they found it, yay. Okay, wait, is it the top button? It's not moving. Oh, it's the, okay. Okay, there. Looky there. Beautiful. All right. Now that I feel discombobulated, we'll go ahead and start. It's no big deal. You can roll with the punches, right, guys? You just roll with the punches. That's how we get through life. So, like I said, one of the biggest issues I had with patients is compliancy, and they just had a lot of self-sabotaging beliefs that got in our way. I didn't know what to do with that, so I decided I would go back to school and become a psychologist so I could help them with the emotional trauma and the physical issues that they were having. And, so if you're a practitioner and you're not addressing in the front end the emotional trauma associated with the disease, and Dr. Michelle Dawson's going to talk about this in detail, you're not going to get very far with your patients. You're not going to be as successful as you want to be. And you guys that are patients, don't be afraid to get in the muckety-muck. Discover these trapped emotions. Some of these emotions are things that you're not even consciously aware of, but it must be addressed, not only to heal initially, but to stop reoccurrence. So that's a big challenge we as practitioners have with our clients. And then how many of you think that the cost of functional medicine is a lot? It's a lot to deal with, right? I mean, I do. I'm a practitioner and I charge patients, and when I go to the doctor, I'm like, wow, does it cost that much? Oh my gosh, how does anybody afford this? So cost is a factor too, and that's kind of a problem with us as functional practitioners because, like I said, we want to do everything on you. So where do you need to start to become the most effective or get the most effective care? And it has to be quick, right? Unfortunately, in functional medicine, when you are trying to shift the terrain of the body and reverse disease, it is not a quick fix. My dear friend Lillian McDermott always says, everybody wants a pill for every ill, right? And that is the way we're programmed because of mainstream medicine. And so we need, as functional practitioners, to have a tool where patients can get an instant benefit from it, because they will not stick with a protocol if you make them sick and they feel terrible for 3 to 6 weeks and then gradually feel better. How many patients have felt that? You took a protocol that you thought was going to help you. It made you so sick you couldn't tolerate it. This is the challenge that I have seen over and over and over. And so many patients just give up and they don't continue on. So the tool that I'm going to talk about addresses that. Okay. Oh, wait a minute. Did I go too far? Okay. It's confusing doing two. So I'm going to talk to you about the lymphatic system before I tell you what the modality is. Because this is a tool that addresses the lymphatic system. How many of you are just really well versed on your lymphatic system, what it does and what it's for? Right. Well, there's some of you. Awesome. No, right. Guys, when I was a nurse, I thought, we studied every system of the body. Every system had a textbook. I knew nothing about the lymphatic system other than we had some lymph nodes, and that's where your white blood cells were. So it wasn't until I became a naturopathic doctor and then really started seeing patients with lymphedema that I started paying attention to your lymphatic system. And I can guarantee you that many of your allopathic doctors don't know. You're going to know more than they do when you get done with this. So the lymphatic system, let me just tell you really quick, it's the structure that holds your immune system. So how many of you know that it's important, if you're going to heal from any chronic disease, to have a strong functioning immune system? Well, everybody's hand should be raised, okay? You have to have a strong functioning immune system to combat any chronic disease. And if you don't get better. So that is something that your practitioners, your doctors are working on. They're trying to help your immune system do the job that it was designed to do. I decided years ago to really focus in on the lymphatic system because what I was seeing is lymphatic disorders, lymphatic congestion. The terrain of the body was so inflamed that the patient couldn't get well. And I, just like every other practitioner, would throw supplementation, medications, other types of detox therapies, but they would all go into a healing crisis many times, and then they just wouldn't follow through. So that wasn't working for me. And then, let me see if went the wrong way. And then I started trying to find tools that would help my patient's lymphatic system. Because I worked in oncology, many of my patients came in with lymphedema. Does anybody have lymphedema? I actually have seen several people with lymphedema, okay? And lymphedema is very difficult to treat. One of the biggest issues with lymphedema is that the compliancy is really, really low because it requires the person coming in to a practitioner like myself, me doing manual lymphatic massage and then bandaging them and for day after day after day after day, and then finally fitting them for compression. And most of the people, like in my offices in Florida, they just wouldn't do it. It's too hot to wear those compression garments. It's uncomfortable. Their arms sore. It's not a good thing. And it got me thinking, well, what about the rest of their lymphatic system? I can visibly see a dysfunction in the extremity or the involved area, but what did the rest of the lymphatic system look like in the body? And what I found is that is why they had so much inflammation. Was it started that they had congestion in their lymphatic system. So the lymphatic system, I believe, is the missing link between health and chronic disease. And despite that it's one of the most vital systems of the body, it is the one that's most overlooked by practitioners like myself and, of course, allopathic doctors. I want you to imagine a busy highway at rush hour, and the cars are just bumper to bumper, just like this. It's barely moving. The traffic congestion slows everything down. It causes you frustration. You're delayed. And I want you now to picture that going on in your body. Like I said earlier, your lymphatic system is the highway, the structure in which your immune system goes. And so if it is congested, just like this emergency vehicle, it can't get to the injured area or the cancer or the infection quick enough to help you. And that's what we're seeing when we're dealing with chronic disease. So what you're wanting to do when you start your protocol is you've got to clear out the congestion in your lymphatic system. You've got to dissolve the inflammation that's been created in your body that's causing the disease. We're all about root medicine, root cause medicine, right? So this is the beginning of your journey. Getting happy. So a lot of people don't even know what kind of diseases are associated with lymphatic congestion. And there's so many, I couldn't put them all out. I only have a few minutes to speak with you. But anything that is linked to inflammation is linked to your lymphatic system. We already talked a little bit about lymphedema. Well, yeah, lymphedema is a huge one. The majority of the lymphedema cases that I see are secondary, not primary lymphedema. In the 30 years that I have been working with patients, I can tell you on one hand, that's how many primary lymphedema cases I've seen. The rest have been secondary, and secondary is due to surgery, radiation, or infection. And it's not a simple thing. It's very dangerous. You can scrape up an arm or a leg that's edemic just by walking, in your garden. You can get a cut and get sepsis. It's a dangerous, dangerous thing you do not want to deal with. But doctors don't tell patients that they're at risk when they have these certain procedures. And they certainly don't send them to a lymphedema specialist like myself, post-surgery. And that would actually prevent a lot of these cases from developing. So keep that in mind. We talked about chronic inflammation. A sluggish lymphatic system leads to increased inflammation throughout the whole body, even the nervous system. It causes autoimmune diseases and metabolic disorders. And they say 94% of the population is metabolically broken. This is one of the reasons. Of course, toxic overload, all kinds of immune dysfunctions are associated with lymphatic issues and can be benefited by certain modalities like this. So if you don't remember anything that I say, remember congested lymph equals weak immune system, and that will equal chronic disease. And so you walk back through that. So if you have a chronic disease, you've got to fix your weak immune system. And by doing that, you've got to decongest your lymphatic system. I've been working with oncologists, a cardiologist, internist, and we have found that when we integrate assisted lymphatic therapy, which is a device that actually helps dissolve congested lymph, with other types of modalities, they're much more effective. I've been testing it out just this year with peptides on patients who do lymphatic therapy and those who don't do lymphatic therapy. When we inject peptides, who actually gets the most benefit, and it is the ones who you actually decongest and get rid of the inflammation first. These are just some other conditions. Lymphedema. Lymphedema is inflammation in the adipose tissue. It's probably the one of the things that are most undiagnosed. Of course, cancer, cardiovascular disease, arthritis, that's a lymphatic issue. Fibromyalgia, which is a condition that, is where pain moves around in the body. That's a lymphatic issue. Autoimmune diseases, allergies, GI issues, which so many people have these days. Hypertension, sleep apnea, acute and chronic inflammation, and neuroinflammation. It's only been in the last 10 years that we've discovered that you do have lymphatics in the central nervous system. All of my other textbooks said we didn't. However, we've been treating that for the 30 years that I've been in practice. So how do you stimulate your lymphatic system and wake up your immune system? Because imagine this too. When you have a congested lymphatic system, it can be in a degree where it is just a little congestion, which can cause you to have some allergies, some aches and pains, not too symptomatic. But as the fluid gets thicker and thicker, it becomes like butter, and in some cases like cottage cheese, and in other cases it becomes fibrotic, and that can be a huge problem in recovery. So we want to catch these things early on. Let's see, I'm going to catch up. This is not an easy thing. So I do all kinds of things in my practice. We do, of course, nutrition. We have to address the deficiencies because disease is only due to excess or deficiencies, right? And so you can have too many toxic burdens, environmental toxins, or you can have, not enough of the critical nutrients your body needs to function properly. So yes, those things are important. They have to be addressed. But even before that, it's what I have discovered in my practice and what I ignored for years and years was really the importance of the mental health of the patient, the mind-body connection. I read a quote from an unknown author this week that said the mind, body, and the soul are so intertwined that they catch each other's diseases. And I have learned that to be so true, so true. So you do have to address both. And that's where my relationship with Dr. Michelle came into play. My mentor, Dr. Cowden, kept telling me, Jennifer, you got to meet Dr. Michelle. You got to, start using some of these tools that she has with your patients. It's going to make all the difference. And I'm like, yeah. I'm focused on this. And I'm worried about the physical symptoms, and it's easy to do because you're trained in medicine to address the symptoms, and it takes so much time to address the root cause. And patients just want their symptoms better, but you really have to pay close attention to the mind-body piece. And Dr. Dawson's going to explain that and how that goes along. So we have been working together on cases for years now. And she's going to share, I'm going to share with you a couple of case studies, but she's going to share a very precious case study that began our journey. And then, of course, lymphatic therapy is what I have been talking about. And most of you know and have heard of manual lymphatic therapy. Manual lymphatic therapy, like I said, involves and is usually designed for lymphedema. It's not a full body approach. There are some massage therapists that do a full body approach, which is awesome. 70% of your lymphatic system is directly under your skin, but the other 30% is where your immune system lies. And so in order to really direct and guide your immune system, we have to be able to reach that deeper lymphatic, which is more in the belly and in the gut. Okay, so that's why manual didn't really help us as functional practitioners really make a dent in the immune health of our patient. It definitely did help with the lymphedema cases, but like I said, they weren't even compliant with that because they had to come into my office every single day to get massage and then leave there bandaged up, and then after a period of time they would be fitted for garments, and we'd have to repeat this periodically, and it just took away their life. So years ago I started searching for an alternative, and I found it in inert gas ionization devices. Sky David is the actual scientist who developed this technology for me, but the reason I needed this is I needed to be able to do a therapy that patients could live with, that wasn't so expensive, where they could come in once a week instead of every day, and hopefully not have to do compression in garments. And this is what I found. And so initially this is what I used it for. But what I found out after working with a group of autistic children in Sarasota, Florida, is that if you do the whole body, it increased better absorption of the nutraceuticals. All of those kids that I worked with about 15 years ago were on the DAN protocol, and it was a suitcase full of supplements. And they would almost just gag as their mom or dad, gave them these things. And these kids' guts were shredded, their immune system was down, they had neuroinflammation, they were a wreck. They needed those supplements, and they needed it to be that type of protocol, but it wasn't working. And a naturopath friend of mine had a son who was severely autistic, nonverbal. She said, "Would you help us?" And I'm like, I don't know what to do with this kid. But we just started this therapy. And in a short amount of time, it helped us to reduce 50% of the DAN protocol for these autistic kids. They got better absorption. We got rid of the inflammation, especially in the belly and in the brain. After just a few months, this child started to be verbal. And so we started seeing this pattern with this. And with Josh, which was the child of the friend of mine, we were able to reduce his protocol 70%. And it was amazing. I never will forget the day that he walked in my office, the kid that was nonverbal that I really didn't want to work with, come in, and I had been preparing myself to deal with him because he would throw things and he was just wild. But he came in, I had my head down looking at my computer. He comes over, he puts his hand on my back, and he says, "Hi, Miss Jen." And I started bawling. And that opened up my heart to autistic kids. So you can also balance hormones. You can, oh, I'm sorry. Thank you. Thank you so much. So it was just amazing. So you can get many, many benefits, and you're welcome to come to me and ask me because I've got to get through. I'm running out of time. Get through this. Any questions that you have about this therapy? It is FDA approved. Not that that means anything, but it does if you're a practitioner and you're going to use this type of device in your office. And it can be covered by insurance for lymphedema patients. All right, so let's talk about a couple of case studies really quick that Dr. Dawson and I worked on. And so after my discovery that I needed to really address the emotional root to disease, these were some of the cases that helped me to see that. I had this lymphedema patient. She had lymphedema in her left arm, and she was coming in for regular assisted lymphatic therapy. We had tried bandaging on her. She was like, "Nope, not doing it." But what I found out, as every time she come in, we would talk, she started opening up and sharing. She had a lot of emotional trauma. And she was riddled with fear, like so many patients. She didn't feel like she could take the relationships in her life any longer. She had a terrible relationship with her husband. She felt like her family was always trying to attack her, and she was discouraged. She felt devalued, and she was just ready to give up. And she had already gotten through the cancer. This was just dealing with the lymphedema and just moving on with the rest of her life. And so we did the assisted lymphatic therapy, and I noticed that we'd get a reduction immediately in the arm, but within the next week, it would come back, and we'd have to start over again. And she wasn't able to come more than once a week. And so I thought, let's start working on the emotions. And that's where I pulled in Dr. Dawson to help. And she did. She addressed the emotional conflicts that she had, and immediately she started to have a reduction, and it held from week to week. So this is just after a few weeks of therapy. This is another guy who had cardiovascular disease. He had edema. This was bilateral. You're only seeing one of them, but he had edema. It was fibrotic, and so same scenario. He had a lot of trauma that he had not dealt with. He didn't know what direction in life he was wanting to go. But this is before and after assisted lymphatic therapy and the emotional work. I just will tell you, it makes all the difference in the world. I'm not going to bypass that. Last case study before I bring up Dr. Dawson was a child or a 29-year-old lady who had anxiety. I see this in a lot of young people today. They have anxiety, then they have all kinds of gut issues, IBS. This lady, she did nothing but worry and really could not understand why. But this is a common thread in her family. Her mother had it, some of her aunts had it, and Dr. Dawson can explain this much better, but it was like a family curse. Every one of the ladies on her mom's side of the family dealt with this. So she came in, we started doing assisted lymphatic therapy, and it helped dissolve the inflammation, but it really made the difference when we started to do the emotional release work, and it took a very short amount of time before she was in full recovery. And so that's where I have landed today. I think it's extremely important. Extremely important to address the physical things. Yes, most definitely. Address the inflammation in your body first. Get your lymphatic system working. Get your immune system circulating, because when you decongest your lymph, you're speeding up the time it takes for your immune system to act. And so that's a big thing. And then start your supplement protocol, start your pharmaceutical. Everything will work better, but do not ignore the emotional component, because that can sabotage your success. So with that being said, I want to introduce my very best friend, Dr. Michelle Dawson, LaMasa Dawson. She's got a long last name. And she's going to explain to you a very precious case study and just where she comes from and what she has taught me and what she has taught her patients from around the world. Dr. Dawson's a big deal. She is the head of Recall Healing USA, and she works with other countries, helping Ukraine and Russia, helping them to heal from all the emotional trauma that they're going through. So, Dr. Dawson?
Okay, so I'm just gonna go with it, and I'm gonna tell a story, and it's super important story, and so we are gonna get this done. Let's take a breath with me. That's what I do, mind-body medicine. So when we're stressed, we need to breathe. We need to drop into our tummy. We need to breathe. So I teach a modality called Recall Healing. It is a mind-body medicine modality. It utilizes life experiences, somatic awareness, and the client's genealogy to address emotional roots of cancer and other illnesses, behaviors, all kinds of different things that I do to help people. Is that, where did the top one? I think we're good. Okay, so in Recall Healing, our job is to expose the hidden emotions that can negatively affect a person, especially causing disease, and to resolve those emotions. I hear lots of times people say, you know what, that's in the past, and I don't want to talk about that. Well, if you don't want to talk about it, or you don't want to see that person, guess what? Your body is going to respond, and that's what happens. And so in Recall Healing, we use specific emotions. When somebody comes into my office, what is the diagnosis? That helps me to understand that there are specific emotions related to that disease, and I begin to ask questions. We look at what we call the project purpose, the repetitive life cycles, and the generational syndrome. And I'm going to explain all of this in just a second. Come on. It doesn't want to. There we go. Okay, so life experiences actually should be beneath the waterline. So we look at illness like an iceberg. The tip of the iceberg is what is in the awareness. So whenever I ask someone, why do you think you have that? They always give me some answer, particularly stress, but it's stress specific. And so we have to look at every disease, every illness a little bit differently. So we look at life experiences, kind of like when you go to a family party and they're talking and all of a sudden you remember that story that you had forgotten all about. It's just beneath the waterline. But our life experiences play a huge role in what we experience in our body. Then the project purpose, which is before we're even born and all the way through our first year of life, and how our ancestors, what they have experienced and who we line up with, who we're named for, all of those things matter. Okay, and so we look at, so sometimes people come in with symptoms. Well, that doesn't help me because sometimes we're looking, if you're just looking at symptoms, like in this case that I'm going to explain, then you may be off track. And so it's really important when you do have a diagnosis, you can look at that specific relationship. So here we go. So Adam's story. So this is a really important story that Dr. Jenny and I worked on, and I'm super grateful. It's especially close to my heart, and I'll share why. So this little guy, 5 years old, the family, he starts to have outbursts and crying. He's tired. He's not his normal little self. And if you could see, his eyes look kind of funky. His face also has a different kind of affect than he normally had. So when we worked with the symptoms, he was depressed. And so mama started to change his diet, and mama started to pay attention to certain things. They had just moved to Minnesota from California. So no more sun, no more family. And it was really hard for him. And then he started school and he started getting bullied, and there was lots of different things. But those symptoms started to progress in about 5 months' time. And so we started to look at different things. And I visited the family and realized that they had moved into a home that was beneath the basement in northern Minnesota, where there had been lots of mold. And the apartment manager said, "Oh yeah, we cleaned it all up." Well, we know that there's mold spores still in that. And so Adam, he was sleeping in this room, and so he was breathing it in. But he's the only one that got sick. So in my work, we have to look at why only him. If you don't have a conflict, you will never get sick. But if you have a conflict that is not addressed, then you will get sick. And this is where Zyto comes in. And there was an MRI. We started doing recall healing. And we did some EVOX and lymphatic work. So lots of things. So in my work, we work through German New Medicine. And that is the science behind what we do. So we look at the being, the person as a 3-tiered being: psyche, automatic brain, and body. And that everything that we have experienced in our life is processed through our psyche. And if our brain thinks that we are threatened by our stresses, by the things that we have experienced, then the automatic brain, our amygdala, will take it out of the psyche and download it into the body according to how we feel. Every disease, every illness has 2 phases: that sympathetic overdrive and the parasympathetic. And oftentimes, a cancer diagnosis happens when the conflict is over. And so we look at the way that we form in our mother's womb. We look at the embryologically vital or protection or what's going on in our territory. We look very specifically at those things. Okay, sorry. Okay, so beneath the waterline. So we started to really look at what was going on with this little Adam. In his project purpose, which is the 18 months before a child is born, 9 months before conception, everything that mom and dad have experienced in their life, but they haven't resolved, that goes into the ovum, into the semen. And then the conception. What happens at the conception? What happens when they find out that they're pregnant? What happens when the child is born? Are there any conflicts related to that? Oh my gosh, it's not moving, Jenny. There we go. So for Adam, his mama, 9 months before conception, There was a miscarriage. She had to have surgery. Mom and dad weren't married. Mom was only 17. Dad was 22. Lots of things. They were living separately. There was worry for both sides of the parents. And so all of that. But when they came together after they found out that they were pregnant, then at 5 months of pregnancy, Mama thought she was going to lose the baby. And so there was spotting. So she was on bed rest. And then ultimately he was born a little bit early. All of these were big traumas. But the biggest trauma was right after he was born. The mama's family had a big party. And the best friend of the father came. And he was like an uncle to Mama. And he takes the dad aside and he holds him at gunpoint. And he says, if you do anything to that child or Mama, I will kill you. And he's a big guy. He's a firefighter, so he's well respected. And so it caused a big deal. It's kind of like when, I'm from California, and so there's an earthquake, there's an epicenter, and then there's shock that is felt outwardly. So the shock was with dad, but the trauma is felt in the child. Because in nature, without mom and dad, child dies. And so our body will do this naturally for us. And there's a struggle for money, and there's just all kinds of things going on. I have no idea what happened here, Jen. All right, here, let me do this. This one. Oh, there we go. Okay. So, thank you. So I got 5 minutes. I mean, it was like, oh gosh. Take another breath. Okay, here we go. There we go. So then we start in that first year of life. Let me go. I don't know how to go backwards. There we go. So in that first year of life, and all through that, the house is raided. They move into this little crazy little apartment because dad doesn't have an education and they're just trying to make it, and so there was another situation where there was this mistaken identity and dad is held at gunpoint again. So crazy. Then the apartment is full of roaches. Mom's doing everything in her power to clean it up, make sure that baby's okay. Baby's like, ugh, roaches and just disgusting things. And then issues with the grandpa. They end up moving in all together. Grandpa, the drug addict, moves in. It is a crazy situation. So all of this stress that mom and dad are experiencing, so is little Adam. And then they get pregnant again. And so dad's like, oh my gosh, what are we going to do? And doesn't talk to mom for a couple of days because he's so freaked out about what's going to happen. And so they decide to move to Minnesota. And so he gets hired and they're going to move. Everything is great. He's got this job lined up with. They're going to live with some cousins. It's going to be this wonderful experience. And they get there and the job has shut down and they're not hiring until the summertime. So now what are we going to do? Get in a fight with a family friend. They're trying to find a place to live. And so then they finally get into this little apartment that had mold in it. So Adam is breathing all of this in. He starts school. He gets bullied at school because he's from California. He doesn't wear camouflage pants like they do in Minnesota. And so he has a little bit of a speech impediment. And so that makes him just kind of stand out. So all of these things, and the winter in Minnesota versus California, super challenging. They're just adjusting. And they thought because they were moving north, they were going to be in the mountains. And if you know Minnesota, it's quite flat. And so that was a big deal. So they're there for about 9 months. And the guy that originally threatened the father, he suddenly dies. And 2 weeks after that happens, Adam starts to exhibit symptoms. And this is all in his little life before 6 years old. So then we look at the generational syndrome. In the work of Anne Anselin Schutzenberger, she started to do people's genealogy. And she started to notice that children with birth order numbers 1, 2, and 3, they were separated. They were still part of the family, But as there were more children, and as she looked above in the family tree, she started to notice that there was this vertical download, that the apple doesn't fall far from the tree. And children with birth order numbers 1, 4, 7, 10, they line up. Children with birth order numbers 2, 5, 8, 11, they line up. And children with 3, 6, 9, 12, they line up. And they all carried the same kinds of things, same diseases, same kinds of early accidents, early deaths, these kinds of things. And so once she put it out on the genealogy, the pattern would stop. What we bring into the awareness doesn't have to return as a destiny. So Adam, he was a number 2, and he lined up with a lot of trauma with that. He lined up with his father, who had been threatened. He lined up with his grandfather, that is the drug addict. He lined up with an uncle that was put in jail at 15 years old for attempted murder. There was so much trauma and lots of different issues from above. Abandonment, not being born outside of marriage, all of these things for the family is big deal, and it's very traumatic. So Carl Jung said, what does not come back to our awareness may return as a destiny. And so that's what was going on. And so it was a perfect storm. The original story about the threat, the download into the cerebellum is old brain, and it's related to protection and integrity. It's responsible to protect all of our major vital organs. And so if there's an issue in our life related to protection or integrity, then it can download into one of those tissues or into the brain itself. He lined up with grandpa, great-grandpa. He had the father's friend, all of these things, these ancestral stories of being the number 2. And then when Tony dies, there's two weeks later, he starts exhibiting symptoms, and they start to get worse and worse. And in our work, we understand that the mycobacteria in the fungus, in the environment, can come to help. So understanding this, having Dr. Jenny do a Zyto, he ends up putting that, and she can see that there is a collection of mycobacteria in the cerebellum. And at that same time, there was a lot of other things going on. And then the realization, I understood, I asked my mentor, remind me about mold. What is this about? And he said, remember, Michelle, mold is about death. And then I remembered, oh my gosh, Tony died. He went into repair phase, or recovery phase. And that's why all of these things. At the same time, he started falling. And so it was crazy. But understanding that was super important, because Mark Twain says that the right word is a very powerful agent. And when we come upon those right words, just like trauma, when trauma happens and, it changes our life forever, when you find the story, it can change your life forever. And so when we understood that, Mom called Dad and said, oh my gosh, you're going to have to talk to Adam while he sleeps tonight, because we do everything energetically, and so that they can receive it, and tell him the story about Tony, and that he doesn't have to carry that anymore. So Tim went in to work. He did it right then and there. And 2 hours later, Adam is jumping up and down. His color has returned. He's still super sick. And Dr. Jenny said, and I want to bring that as a super important point, she did not cause fear. She had an idea that he had a tumor. She had an idea that there might be a cancer going on, but she said, hey guys, I think it's really important that you get him checked out. Well, Mom and Dad already have had an appointment scheduled for a neurological checkup because he was starting to fall. There was other things going on. So he was still really sick. When he got that, they air flew him to a hospital in Minnesota. 2 days later, they remove a baseball-sized brain tumor. But what was so beautiful for me was that it was fully encapsulated. It was exactly what Hammer had said, and that it was starting to necrode. And so, of course, he was really sick. It actually put my faith in and understood that there really is a time and a place for everything. And it all works together, and you use whatever you can to heal that person. So Dr. Sabah, the founder of Total Biology, he said that disease is the brain's best solution to keep a person alive as long as possible. And so just in that conflict, you get extra time if a program has started. So even a cancer. So if we look at it not as an enemy, but as something that came as a turbo function to help us, it gives us a whole new understanding about it. So, oh gosh, sorry guys. Okay, so this is the brain tumor initially. Then after the surgery, there was a little remnant. And so they wanted to continue doing this and to understand, what was going on, to make sure. It took 8 years. So that's why I really want to encourage you that when you're doing this journey, it's not one and done. It's an ongoing journey that you keep going and you incorporate whatever comes into you, whatever you choose. That's the most important thing because it's your journey. It's nobody else's journey. So, but Adam, last summer, the doctors had said, if anything, the tumor will grow and it will never go away. But in this case, it was completely gone last summer. And so these are let me do this. On the top, the current one. And so our children can carry our unfinished business. And so when we do our work, it heals our parents, grandparents, and great-grandparents. And it heals our children, grandchildren, and great-grandchildren. And I am blessed because this young man is my grandson. And I'm so blessed to be able to help him and to understand that my doctorate was all about that. And Dr. Jenny was incredibly supportive. And we did the Zyto, we did EVOX, I did emotion code, we did all kinds of different kinds of things, cleaning up diet, cleaning up the environment. The family moved. It was the thing that needed to happen. So using everything that you possibly can is going to help in your journey, whatever that may be. Okay, I did it. Okay. So we just wanted to know that working together, doing it all, having a teammate that can do some of the things and that you do other things and that you keep going, you keep growing, and perseverance is super important. And so any way that I can help you or my team or Dr. Jenny can, we are at her booth in the therapy area and just wishing you all a wonderful, beautiful journey. The joy is in the journey. So thank you.
Thank you. And thank you for ad-libbing for a bit, both of you.